This week's Ask Dr. Durie comes from a patient who's concerned about the possibility of contamination in cells that have been harvested for stem cell transplantation. And so the question is, can there be myeloma cells in the harvested cells from the blood? And so the answer to this question is yes, there can sometimes be myeloma cells in the blood, and those can be contaminating the harvested stem cells. But there are several important points to that. If you have had an excellent response prior to the stem cell harvest, which is the case for the vast majority of patients, then the number of myeloma stem cells in the blood is very, very low. And so the risk is in general quite low that there would be some level of contamination. But there are some additional very important points. The first is that when stem cells are present, when myeloma stem cells are present, they undergo the freezing and thawing process the same as the normal bone marrow stem cells, and they are more fragile and actually end up being damaged, if not completely eliminated by that freezing and thawing process. The second thing is that even if there are a few myeloma stem cells present, there are no data to indicate that they would ever actually cause relapse in the patient. When this was studied actually 10 to 15 years ago, when there was more of a concern about this, it was discovered that when a myeloma patient relapses, it's always from cells which have remained in the body of the patient, and it was never due to any small number of myeloma stem cells that are re-infused from the harvested material. And so the bottom line is, yes, there can be myeloma cells in the harvested stem cells, but they are very unlikely to cause any trouble and actually have never ever been shown to cause relapse in the patient. So a concern, yes, but actually a problem for the patient, fortunately, no.